Today we talk to veterinarian Dr. Josh Sosnow, the owner of 2 veterinary hospitals and co-founder and chief executive officer of Companion CBD. Hi, good morning, Dr. Sosnow.
Good morning.
Ooh, you're going to do the show from the car. I like it.
Well, I could do it in the office, but this is the quietest place for it, actually.
How are you?
Good, thank you. Looking forward to it.
Dr. Sosnow, you have been a veterinarian for over 20 years, and you own 2 veterinary hospitals here in the Valley, but you are also the co-founder and the chief medical officer for Companion CBD, and that is the first and only veterinary operated and owned CBD manufacturer in the United States. So you're a very busy man, so thank you so much for talking to us today.
You're most welcome. Happy to be here.
So I have some questions in regards to pet owners that move to the Phoenix area. I know there's so many people that are moving to Phoenix every day, and of course many of those are dog owners. There are so many unique things here in the Sonoran Desert. What are some of the things that you would recommend for somebody that's new to the area?
Well, the first thing is to be mindful of the heat. Unfortunately, from late April, early May through the end of September, the heat is so intense that it really limits the activity of not only people, but their pets outside during the hot months of the year. Heat stroke is a very real concern. It can be a very deadly concern. And not just that, but paw pad burns are something we see. I usually tell people that, if you have to choose a period of activity, try to make it before 7 in the morning or after 7 in the evening. And, if you can't walk outside comfortably and barefoot and tolerate the heat, then it's fair to say that your dog couldn't either. So, being mindful of the heat and providing ample quantities of water is an absolute necessity. Obviously, traveling with your dog in the car during the summer is an added risk, simply because they can't be left alone in the car for any length of time for fear of inducing heat stroke.
Yeah, you really have to plan your trips here much more so than, in other parts of the country.
You do. And, during the summer months, it doesn't take long for the car to begin to heat up to a dangerous level. So, there was actually an interesting study, just as an aside, done now probably about 10 years ago, looking at the temperature of surfaces around the city. And what we found is that sometimes some of these surfaces, especially pavement and sidewalks, can get close to boiling points. So you can imagine what could happen in an enclosed vehicle with no air movement in a very short time. The temperature can rise rather quickly and, lead to heat stroke and even death. Some of the other concerns are things like rattlesnake bites. We have several times of year, early in the year, anywhere from about February to April, May, and then at the end of the year, in September, October, November, when rattlesnakes are active. And people who are used to hiking, people who have large yards, people who have property and let their dogs roam, are all people whose dogs would potentially be at risk for rattlesnake envenomation. It's one of those things that when it occurs, it's extraordinarily painful to the dogs, and it requires immediate medical attention to minimize the risk of complications. So the treatment is to administer antivenom. So essentially, we're administering antibodies which bind to the venom, take it out of circulation, and stop it from actually destroying tissue. That, along with aggressive pain management and monitoring to determine whether there are going to be any blood clotting abnormalities, is usually the mainstay of treatment for dogs who've been bitten by rattlesnakes.
So if I'm on the trail, my dog has been on the trail, should I be moving the animal? What are some of the things that are like the first aid that I could do to help the dog and get him to the veterinarian?
The best thing that I can recommend is that, well, first of all, realize that most dogs, when they get bit, get struck in the face someplace. Secondarily, in usually the front paws. The best thing that you can do, since it's an excruciatingly painful thing to have to undergo, is to call the veterinarian right away, let them know you're on the way, and get them in as quickly as possible. It's hard, unfortunately, to do anything first aid wise at the time. And to be perfectly honest, until they have ample pain medication on board, we don't do a lot to manipulate the wound because it is so painful. So it would be tough for somebody on a trail to be able to clean or tend to the wound without causing tremendous pain to the pet.
Is it okay for the pet to move? Like, for instance, if I have a really large dog, do I have to try to keep the dog still and carry him? Or is it okay if the dog can walk out by itself?
No, the dog can actually walk out under its own power. Absolutely. It may take some coaxing, obviously, but there's no reason why the dog would have to be carried out of that situation. The best thing you can do is to avoid contact with the area. The venom goes to work very quickly, causing a tremendous amount of tissue inflammation, which can produce pain. So, avoid contact with the area at all costs while you bring the patient down from the hike.
And that is such good information, because from what I've read, there's so much misleading information about, from anything from sucking out the wound to, bandaging and things like that. So I think this is going to be really great information for, the people that hike with their dogs.
Oh, no, I hope so, because it is one of the most excruciatingly painful things we see in the short term. And it's really unfortunate when people try to administer first aid, admittedly with the best of intentions, but it is excruciatingly painful.
So there's all kinds of other animals that we can come across on the trail, like scorpions or venomous spiders. Do you see a lot of that, or is rattlesnake bites the most common?
So rattlesnake bites far and away are the most common. Admittedly, when it comes to something like a scorpion sting, I have yet to see an actual documented scorpion sting that I can confirm, perhaps with the tail of the scorpion sticking out of the animal. To be honest, it would look rather similar to a wound from, say, a cactus thorn. It would be rather difficult to identify it definitively as a scorpion sting. With that said, we do have spider bites that we do occasionally see, or at least suspected spider bites that we occasionally see. Again, they can be difficult to identify as a spider bite. It's really supposition on our part, which leads us to think that perhaps the dog did have contact with the spider. Obviously, the spiders that are of greatest concern would be things like a brown recluse, which would give a very painful localized bite and lead to some tissue damage. And of course, the one that we always worry about here in the valley is black widow. But I can't say that in nearly 20 years of practice, I've ever actually seen a black widow bite a dog. That said, spider bites are rather rare, as are scorpion stings. The other critters that are out there, various insects, arachnids, certainly we see bee stings, we see other things that crawl, that bite, that lead to facial swelling, for example, or hives. As a general rule, those things aren't life-threatening. With simple treatment on our part, they resolve very quickly. So it's not something that we have people spend too much time being concerned about.
I kind of wanted to go back to the heat thing you were talking about. I know that because it's such a big deal in Arizona, I know with our clients, when we do any kind of training, I tell them to put their hand on the asphalt. If they can't put their hand on the asphalt, that's what the dogs feel. And it gives people a kind of a perspective of just how hot the asphalt can be.
Absolutely. And, even with the aid of something like booties, the ground can heat up and heat those booties up very quickly. So that's why, as a general rule, I tell people, before 7 a.m. would be ideal, because, you have the evening hours for the ground to cool, or certainly after 7. But again, I tell people, if you have any doubts, walk outside barefoot, stand there for a few minutes. If you can't tolerate the heat, then there's a good chance your pet can't either.
What are some of the signs of heat exhaustion in a dog?
So heavy panting, obviously a warm body temperature or a warmed body, oftentimes vomiting and diarrhea if it's more advanced. And usually the vomiting and diarrhea includes the presence of some blood or dark stool. The patient's very lethargic, profoundly lethargic, in fact. Oftentimes they can be what we call, or what we refer to as, laterally recumbent, meaning laying on their side. And obviously, they'd be seeking out cool surfaces as much as possible. It's often thought that dogs principally cool themselves via panting, but in fact, the primary way they cool themselves is through conduction of heat, so transfer of heat from the body directly to the environment. So that's actually one of the treatments, is to get them in a cool service as quickly as possible to get as much heat drawn from the body to cool them as quickly as we can.
So there would be, again, coming back to, like I said, I hike a lot. So there are some first aid things that somebody could do to help their dog, like maybe wrap them in a cool towel or a wet towel. Or
absolutely. Or even use a hose to wet them. We don't want to cool them far below their normal body temperature, but using a hose to cool them so they get that evaporative cooling effect is something that's very effective. Ice packs can be very effective, especially on the paws. So there are a few things that people can do at home if they suspect their pet is at risk for heat stroke.
And a percentage of their heat goes out through the paws also. So if you put their paws in water, maybe, or something.
You could put them in water, or an ice bath would be even better. They could, help regulate their temperature a little bit more quickly. And so many pets enjoy the timeout so much that they're willing to push past their own limits. And the owners may not realize when they've exceeded their limits and at risk for something like heat stroke. It may look like nothing more than heavy panting early on, and they may mistake that for a dog just trying to cool itself. But the hard part about being in Arizona is that since dogs ideally transfer heat to their surroundings, when the ambient temperature, the temperature of the air is so warm or is hotter than body temperature, it's very difficult to offload that heat to the environment. So it gets trapped in the body, hence a rise in body temperature, ultimately leading to heat stroke.
That's a good point. No, if the ambient temperature is as hot as the dog is, it doesn't help much.
Right.
I hadn't thought of that. That makes
Yeah.
sense. Now, one of the things that always scares me a little bit, and we, haven't been around dogs for, most of our lives, unfortunately. I've already seen a couple of dogs with valley fever. Can you kind of talk about that subject a little bit for our viewers?
So valley fever is an interesting disease. Oftentimes we describe it as an enigmatic one because it can mimic so many different things. It is ubiquitous. It is everywhere here in Southern Arizona. So just by virtue of living here, you're at risk. Even if you have a dog that lives principally inside, it doesn't mean they escape the risk of being exposed to valley fever. Because it's a fungal disease, the spores are everywhere in the soil, in the air, and we inhale them all the time. And what we believe to be true, just like on the human side of things, is that it's the individual's immune system. It's the way the immune system handles or doesn't handle the organism that ultimately leads to disease. Whereas we used to believe in veterinary medicine that if you lived near a construction site, if you lived near an Indian burial ground, if you had a dog that was a digger or one that, say, attacked rodent burrows, the increased exposure would lead to disease. It doesn't necessarily hold up because most of the dogs that end up getting valley fever haven't had exposure to any of those things. So as a fungal disease, it's a little bit more of a challenge to diagnose because we rely both on compatible clinical signs and a positive test, but sometimes the tests that we do, the test results fall into a gray zone and you have to interpret them in light of what's going on with the patient. Fortunately, we have very good and very safe medications these days to treat valley fever. Admittedly, it's not as simple as treating a bacterial infection, which may require only, say, 10 to 14 days of antibiotics. Oftentimes, the average period of time that a pet is on valley fever medication is anywhere from 8 to 12 months. So the medications that we use commonly don't actually attack the fungus and destroy it in the body. All they do is weaken it. And so ultimately, we rely on the body's own immune system to clear the infection. It's admittedly so well recognized here in Arizona, especially Southern Arizona, that whenever we have a pet in which we suspect might play a role, we test for valley fever. It's well recognized in the veterinary community. And, admittedly, there are certain breeds, for example, boxers, which we think may have increased susceptibility. But by and large, any dog is technically at risk. In fact, we also have to accept the fact that some dogs may get sick and we never know it because the illness is so minor and that they recover from it without any issues. If you ask me what percentage of dogs that actually is versus what percentage of dogs actually get sick, the truth is we don't know. But it is a disease that is unique to this part of the country, the Southwest, parts of California, and even parts of northern Mexico. But again, it's so well recognized and it's on our radar screens all the time that we're careful to evaluate for it. On occasion, we also see some seasonality. So there's certain seasons of the year, like after the monsoon seasons or during the monsoon seasons, when you have so much dust stirred up into the atmosphere that you have more spores in the atmosphere, where we sometimes can see an uptick in the number of cases. That's not necessarily been proven time and again. It's just from observation. But it makes sense when you're putting so much more of this material into the atmosphere that some dogs who are susceptible are going to get higher exposures.
Is there something as a pet owner that we can do to prevent valley fever, or is it just something that you can't do anything about?
Unfortunately, it's just a risk that we live with here in Southern Arizona. There is certainly ongoing research to look at the possibility of a vaccine, but no vaccine is available yet. There's a tremendous amount of research that goes on, for example, with the University of Arizona's Valley Fever Center of Excellence, looking at potential protective measures such as a vaccine. But thus far, it's one of the few environmental risks that pet owners, specifically dog owners, have to deal with when they live in Southern Arizona.
Is that kind of a thing that the dog doesn't actually get rid of valley fever, it just puts it into submission, or can it actually be knocked out?
Well, we don't know. We do believe that some animals will knock it out completely. There are others in which it may go dormant and stay dormant for a prolonged period of time. And perhaps it's important to also mention some of the clinical signs associated with valley fever. I would say that the most common presentation, the most consistent presentation that we see is of a dog who's just not doing right. Classically, if you read in a textbook, you'll read about things like a dry hacking cough, perhaps enlarged lymph nodes, lethargy, loss of appetite. On occasion, you'll see a limp or lameness. And on rarer occasions, actually see a wound in the skin that seems like it wants to heal but never does. Those are the more common clinical signs that we see associated with valley fever. But there's so many other diseases which can produce similar sets of clinical signs. So at times it takes somebody who's actually seen the disease and the appropriate testing to make the diagnosis.
You know, you spoke about hopefully there might be a vaccination, so maybe that's a good segue to ask you about general vaccination. So, you know, we obviously are always very big in when we, you know, train puppies, we always tell people, you know, be sure your dogs are properly vaccinated before you go outside. Do you see that most dog owners are pretty vigilant about vaccinating their dogs, and what are your thoughts on that?
Well, first of all, fortunately, in the area that we're located, the vaccination rates of our pets is exceedingly high, and the risk of contracting puppyhood diseases like parvo or distemper is actually quite low. Just as an aside, I'll make mention of the fact that since we talked about rattlesnakes, that we do actually have a rattlesnake vaccine, which is available. What it essentially does is it takes inactivated snake venom, and when injected, it causes the body to produce its own antivenom, essentially, in the form of antibodies. So for those people who have pets that travel with them, you know, people who are avid hikers, again, people who live on horse properties or let their dogs roam free, this is a viable option to provide some protection against a rattlesnake envenomation should it occur. It doesn't eliminate the need for treatment, but it significantly reduces the severity of the bite wound if it occurs. As far as other vaccines are concerned, there's no question that, you know, puppies should be fully protected before they undergo any type of group training. You know, we have what are considered to be core vaccines by the American Animal Hospital Association. Those core vaccines are the distemper parvo vaccine, the rabies vaccine, and the kennel cough or bordetella vaccine. So at the very least, puppies should have gone through a series of those vaccines before they engage in group play or really socialize with any strange dogs in strange places, dogs that the owners aren't familiar with and whose medical history may be somewhat unknown. What we do as far as vaccination is concerned going forward very much depends on the risk of exposure and lifestyle the dog is going to lead. Not every dog is going to receive the same set of vaccinations with the same frequency. As a general rule, some of the core vaccines like the distemper parvo vaccine and rabies vaccine are administered once every 3 years. But things like the bordetella vaccine or other vaccines like leptospirosis or Lyme disease may need to be boosted on an annual basis. based on, again, an animal's risk of exposure and lifestyle. So even though we have guidelines as far as vaccination is concerned, we also have to use our clinical judgment to determine what's appropriate for which pets.
Now, for those of our viewers who travel with their pets, is vaccinations throughout the United States, is it pretty standard, or are there areas where there's different types of vaccinations recommended?
So the vaccines themselves, in other words, the type of vaccines used are pretty standard. However, the need for those vaccinations does vary from region to region. In certain parts of the country, we have a disease called Lyme disease, for example, in the Northeast, whereas here in Arizona, we don't have Lyme disease. So it's standard practice in the Northeast to vaccinate pets against Lyme disease, whereas here in Arizona, we would only do so if a pet traveled to the area. Similarly, there's another condition called leptospirosis, which we don't really have for the most part in the environment here in Arizona, but in other parts of the country, like the Midwest or the Southeast, leptospirosis is an issue. We vaccinate here in Arizona for leptospirosis because of the risks associated with the influx of so many people from other parts of the country during the winter months. And we've actually had an outbreak of leptospirosis here going back several years, which made a lot of pets in the community sick. So it is something that we choose to vaccinate our pets for these days because of that risk of exposure. But no, you're correct that the way we vaccinate pets varies depending on where you live and depending on your travel history or intended travel plans, because, for example, oftentimes, for whatever reason, we see outbreaks of the canine flu in and around the Chicago area. So having a pet that travels to the area may necessitate a flu vaccine. So yes, there are regional differences that occur, and it's important to talk with your veterinarian about what your pet may need should you choose to travel or move to one of these areas.
That's something that we mentioned too. If they travel outside the continental U.S., then there's laws that they have to worry about. Even just going to Hawaii, we have to have shots a reasonable time before they even travel. They can't get it a year before. They have to get it weeks before and have the proper paperwork before they can even get into Hawaii.
That's correct. And even in this country, when you're traveling to Hawaii, it's important that you have the appropriate prophylaxis performed well in advance of your trip so that you are able to sort of dot all your I's and cross all your T's as far as what the Hawaii Department of Agriculture requires to import an animal. But you're correct, too, that the requirements for importation of animals varies from the European Union has its own guidelines, Japan has its own guidelines, Australia. They all have differing requirements based on the potential for transmission of certain diseases. So it is important to always talk with the consulates of any countries you intend to visit with your pet. Find out what is required of you well in advance of the trip. And these days, there are even services that people can rely on that'll help people make these arrangements. Some services that we work with to provide all the necessary vaccines and testing in order to have, all the guidelines met for transport overseas.
So while we're on the topic of traveling with pets, a lot of times pets can have travel anxieties, sometimes separation anxieties. Are there certain things that you could recommend from a veterinarian standpoint to help with that?
I'd say the first thing I always encourage people to look towards is adequate levels of exercise. Even when you're traveling, your pet still has all this pent-up energy, which needs to be expended. So the first thing is to make sure they're adequately exercised. I think so many of the behavioral issues or anxieties that pets experience when they travel could probably be alleviated if the pet had some way of channeling all that extra energy. With that said, for those pets in which traveling does truly produce anxiety that's not related to an excess amount of energy, there are certain types of medications, calming medications that we prescribe, as well as supplements that can be used to try to help keep the pet calm for the duration of the trip. There are certain pharmaceutical agents, as well as even things like CBD these days, which we use, which is a more, I guess you'd say, natural alternative to some of the drugs that we would typically recommend. One of the things we always encourage people to do especially before they go on a long road trip, is to test out whatever agent that they plan to use to make sure that it has a desired effect. It would really be undesirable to get 2 to 3 hours into a trip and realize that your pet is very anxious and either at risk of causing harm to itself or causing harm to others or even the car itself. So testing whatever agent you plan to use is important. And there's a whole variety of agents that we use these days. Sedatives, anti-anxiety medications, similar to medications that people take. Again, as I said, even things like CBD these days is used as a more natural alternative to help calm pets. And not everything is going to work. Many times, especially in dogs who are particularly prone to anxiety, they can override the effects of the medication. So it may not have any of the desired effect, and either a dose adjustment needs to be made or an alternative needs to be considered.
We are always looking for natural ways to, help our dogs with their health. And I know that you are greatly involved in the research of CBD and also in, making it more known throughout the veterinary community. So can you talk a little bit about that?
So CBD is an interesting compound. It's a compound that's derived from hemp or marijuana. It's nothing like THC, its more famous cousin, which is responsible for the high that people think of when they think of marijuana. CBD has none of those psychoactive properties. CBD, admittedly, just like THC, is also one of many compounds, numbering in the hundreds, that are derived from these particular plants. Many of which are thought to have therapeutic value, although we're still really learning which compounds do what and how successful they are. With respect to CBD, CBD is used to manage a variety of conditions at the moment with varying degrees of success. Some of the more common conditions that we use it with are things like osteoarthritis, the management of seizures, the management of anxiety. It's used to help manage allergies and even certain types of GI diseases. And admittedly, we're still finding new uses for it. The mechanism of action of the compound in the body is still being understood, but it oftentimes works through the nervous system. And one of the nice things about it is it's very compatible with most of the major classes of drugs that we typically use, or certainly can be when dosed appropriately. The nice thing we find is that CBD sometimes acts as a nice adjunct to upregulate some of the medications we use. For example, when treating patients with arthritis, it's a nice tool very early in the stage of development or very late in the stage when they're on other medications to provide CBD without causing a tremendous amount of sedation or many side effects, and yet still have it, if you will, play well with other medications that might be in the mix. We talked about CBD with respect to anxiety, and there are different types of anxieties that we conceivably use it for. Things like separation anxieties, thunderstorm phobias, for example, anxiety associated with traveling. So it has a lot of flexibility, and it's as we learn more about it, especially as we learn more about it with respect to our veterinary patients, we're finding more uses and finding better ways of refining the dosing.
It's probably the same with the other medications. Is each dog is going to react to it more or less differently. It might help right off the bat. Some might have to do a different size dose or something like that. But it's not like you can get too much medication or something like that. CBD is just kind of, you can't overdose on it, I guess is what I'm trying to say.
Right. It would be very difficult to overdose a patient with CBD. And it is true that there is a lot of individual variation in terms of your response to it. We all have different sets of what are called endocannabinoid receptors in the body. And our receptor profile is going to differ from one individual to the next. So it is very possible that you have two dogs with the same condition of the same weight who might receive two very different doses of CBD to get the desired results. That's not inconceivable. We need to treat CBD similar to like a pharmaceutical agent. And we do talk about it with respect to the number of milligrams per kilogram of body weight when we're prescribing a dose. So it's important to know the concentration to begin with. But also it's important to make it palatable. Hemp oil, as you may or may not know, is not the most palatable substance around. And giving larger volumes of oil to larger pets sometimes can cause some GI disturbances. So we wanted to provide a way of administering the CBD that was both palatable to the pet and that was easy to administer as far as the owner was concerned.
Now, even though you're in Scottsdale, you actually have a service that people can get in touch with you through the internet and talk to a vet or something like that. So they don't have to go out on their own and try to figure out what's going on. They can actually call the company and say, this is what I have. What do you recommend?
That's correct. There's something called the Ask a Vet feature on our website at companioncbd.com, which allows them to generate an email, which comes directly to us if they have questions about how to dose CBD appropriately or about questions about our product. And fortunately, the turnaround time is usually same day. So owners will usually get the response they're looking for within a couple of hours.
And you all can actually ship to that customer also, so they don't have to go out and get the guy in the corner or something like that.
Correct.
It's not going to be really stuff.
Correct. We do sell the product online through our website, so somebody can buy it direct from us, and we ship it to them here within 2 days.
I think part of your mission too is to educate more veterinarians and more clients about CBD. Is that true?
Well, believe it or not, as veterinarians, either veterinarians who are of my age or younger don't learn about the endocannabinoid system in school. So it's a new science, it's a new medical science, a new discipline. So it is incumbent upon us to sort of teach the basics first and then introduce the idea of, clinical applications a little bit later. So that one of our goals here is to try to educate veterinarians on how best to use CBD in a clinical setting so they can do so accurately and get the desired results their clients are looking for. Because of the gray area from a regulatory standpoint that exists for CBD, a lot of veterinarians are averse about laying their hands on it or even learning about it at the moment. Similarly, there are those that see CBD or CBD-like compounds as perhaps a fad, something that's not going to stick around for a while. But as we've seen on the human side, more and more phytocannabinoids, of which CBD is part, are being explored because of their therapeutic purposes. And now we actually have one FDA-approved drug, mainly on the human side, used specifically to manage seizure activity in children. So CBD, its phytocannabinoid cousins are definitely here to stay. So it's incumbent upon us to learn how to best administer them in clinical practice and advise our clients, because I still feel as a veterinarian, we're the best source of advice with respect to our pets' overall health.
Well, thank you so much, Dr. Sosnow, for taking the time today. I know you're a very busy man. There's a lot of great information. And of course, for those of our viewers who would like to find out more about your company, we'll make sure to have your links in the description below the video.
Well, thank you very much for having me. It's been a pleasure.
Thank you for watching today. I hope you enjoyed the information. And until next time, keep your paws on the road.